Good evening and welcome. I'm Susan L., Vice President and Executive Director of the Foundation for Barnes-Jewish Hospital. I'm so pleased that you could join us for tonight's Leading Edge Nursing program. This is the Foundation's second Leading Edge Nursing event, and I cannot think of a better time to highlight the nursing profession and the incredible nurses at Barnes-Jewish Hospital and throughout the entire BJC healthcare system. This past year and a half has taught us so many things: how to work differently, how to communicate differently, and it has given us a renewed appreciation for our frontline caregivers, and most importantly for this evening, our nurses. The mission of the Foundation is to enrich lives, save lives, and transform healthcare. And who would know more about that than our very own healthcare heroes? As a nurse myself, I can attest to the selfless dedication and resilience of those who enter the rewarding profession of nursing. However, I did not experience being a nurse in the midst of a global pandemic, and I am as intrigued as all of you are to hear firsthand from our guest speaker and our esteemed panel. Our featured presenter and moderator tonight is Dr. Angeline Peters-Lewis, Vice President, Chief Operating Officer, and Patient Care Services Chief Nurse Executive at Barnes-Jewish Hospital. She's also a tremendous partner to the Foundation and a wonderful friend and colleague. Dr. Peters-Lewis is joined tonight by a panel of her colleagues, float pool registered nurses Amy Russell, Lynn Kemper, and David Becker, and emergency department registered nurse Kivalina Clark. Angeline will share her perspective as a nursing and hospital leader on how the pandemic affected and continues to impact the role of our nurses. We will then hear from our panel of frontline caregivers on the challenges, changes, and successes that they have experienced during the COVID-19 health crisis, followed by closing remarks from the chairman of the Foundation Board, Dick Miles. Now, before we begin the program, I would like to give a special welcome to board members from the Foundation for Barnes-Jewish Hospital, BJC Healthcare, Barnes-Jewish Hospital, and Goldfarb School of Nursing who are with us tonight. Thank you for all you do on behalf of the Foundation, and of course our hospital, our system, the College of Nursing, and our community. Now, to introduce Dr. Peters-Lewis, please join me in welcoming Dr. John Lynch, President of Barnes-Jewish Hospital.
Thank you, Susan. I am so pleased to be part of our Leading Edge Nursing event this evening. We have learned so much this past year about our world, how we interact, and most importantly, how we care for ourselves and others. And our nurses exemplify what it means to care for ourselves and our community. During the course of the pandemic, we have referred to our nurses as healthcare heroes. We also refer to our nursing students at Goldfarb School of Nursing as heroes in training. By whatever name, they are the bedrock of our healthcare system, the ones who lead in the charge of crisis, who step up and sacrifice for the benefit of others, who provide treatment, care, and support for those in need. We are so fortunate to have someone as accomplished as Dr. Angeline Peters-Lewis leading our nursing teams as we continue to navigate the challenges of what we hope will soon be a post-pandemic COVID world. Angeline received her doctorate in nursing from Boston College, where she graduated with distinction and received the Dorothy A. Jones Award for Scholarship, Service, and Development. She earned her master's degree in nursing from Northeastern University, and a postdoctorate work included Executive Nurse Fellowship with the Robert Wood Johnson Foundation and Executive Leadership Development Program at Harvard Business School. Prior to joining Barnes-Jewish Hospital, Angeline was Senior Vice President of Patient Care Services and System Chief Nurse at Women's and Infants Hospital in Rhode Island. Angeline's most recent honors include being appointed Chief Operating Officer at Barnes-Jewish Hospital in 2020, as well as being, Fellow of the American Academy of Nursing. What a tremendous accomplishment. Please join me in welcoming Dr. Angeline Peters-Lewis as she presents to moderates our program, Persevering through Pandemic and Beyond.
Thank you, Dr. Lynch, for that generous introduction. And thank you, everyone, for joining us tonight for Leading Edge Nursing, Persevering Through a Pandemic and Beyond. At our last Leading Edge Nursing, which is available to view on the Foundation's website, we talked about the nursing profession as the intersection of compassion and science. We explored the definition of nursing as the protection, promotion, optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response to illness in the care of individuals, families, and communities. What an expansive definition. And there has never been a time in our history where we have lived every component of that definition so fully as during this pandemic. And while so much has changed in our lives this past year due to the pandemic, the role of nursing didn't change. In fact, it was magnified. During the pandemic, our nurses were still expected to protect, promote, and optimize health, diagnose and treat the responses to illness, but rather than deal with acute situations that occur in a one-day event or disaster, the COVID-19 pandemic required ongoing 24/7 responses to the same illness. It is true that the last pandemic to hit the United States is referenced in nursing education textbooks, and some of our hospital units may have had some pandemic protocols in place, but none of that has prepared us for the scope, magnitude, and duration of the current global pandemic. COVID-19 has had a significant impact on our hospital staff and our nursing teams. The pandemic has presented us with a strong reminder that nursing is, in fact, the intersection of compassion and science. Our nurses were treating patients who were ill in unprecedented ways and patients that were separated from their loved ones. They consistently continue to administer clinical therapeutics in the context of caring, performing assessments and treatments while being hyper aware of the needs of the humans that we treat and our commitment to compassion. To understand a little bit more, it's helpful to share the numbers with you. When we look at the numbers in the early days of the pandemic, COVID-19 admissions started at about 1% of our hospital capacity. At the peak, we were seeing close to 5% of all of our admissions being COVID-related, with 12% of patients tested being positive for COVID-19. It's also important to note that almost 50% of the area COVID-19 patients were admitted to BJC hospitals to provide the very best care and to relieve the strain being put on our rural hospitals. These patients were sick, and they required a different type of care because so much was and still is unknown about this disease. New treatments and new ways of caring for the ill had to be learned, tested, recorded, shared, and tried again. The cycle of learning, of testing new interventions and quickly integrating them into practice was what we had to do to serve and protect our patients, our colleagues, and our community. Nurses had to learn new ways to communicate with patients and families since we were all wearing masks and other personal protective equipment. Now, while communication is really important to every healthcare discipline, it's especially important to nurses. It's the way we convey our compassion. Smiles, a supporting hand on your arms, hugs, all of those expressions of care had to be communicated in new ways. You know what we did? We all became top models, learning how to smile with our eyes. And we had to learn new ways to care for ourselves, wearing masks at all times. To best understand this impact, we can look at COVID procedures the hospital initiated, as well as the statistics of patients within the hospital. To protect our hospital staff and the community, new safety protocols were established throughout our system. These included the use of additional personal protective equipment, improved personal and equipment cleaning procedures, as well as rigorous tracking of how these procedures were followed. As with all new policies and procedures, there were added physical and mental stress to our nursing staff. Never before, when we have served during a national crisis, have we ever done so with the persistent and constant threat to our own health, safety, and well-being. In addition to the precautions taken at the hospital, many of our nurses had to take steps to protect their families and loved ones. Some of them chose to stay in temporary housing or overnight in the hospital. And guess what? We adapted and we persevered. Many of you may remember that during the peak of the pandemic, the hospital suspended elective procedures and surgeries. This decision was made to make sure that we had the equipment and staff available to care for COVID-19 patients, as well as those who needed to be at Barnes-Jewish Hospital because of the unique, high acuity care we can provide to the sickest patients. What this meant for our nurses was that they were reassigned to COVID-19. Many had developed years of wisdom and expertise caring for patients that required procedures, and they were reassigned to serve, learn quickly, and serve on the front lines with their colleagues, taking care of the most critically ill patients that needed our care. And again, we adapted, and yes, we persevered. The hospital had to prohibit or limit visitors for the safety of our staff, our patients, and their families. Families are an important partner in care. They help patients with healing, and it's one way that we help to alleviate suffering. This change in policy introduced stress on the part of our patients who no longer had the support of their families to help them in the healing process. Guess what? Again, our nurses stepped up and put even more emphasis on the alleviation of stress by providing additional emotional support, facilitating digital visits with family when possible, and balancing physical care with the mental care more than usual. Many patients, we use digital visits in unique ways. We help offer hope to patients and families, and yes, we use technology to support families as they made difficult decisions and when they said goodbye to loved ones. And we persevered. You can see a pattern here. I could continue to share my experiences and my perspective all night, but we are so fortunate to be joined by an amazing panel of our own Barnes-Jewish Hospital nurses who can give you their individual accounts of being a nurse during the COVID-19 pandemic. And it is my privilege to introduce, as they've joined me here on the screen, Amy Russell, who works with our acute care team, and that means that Amy travels all over the hospital caring for the most acutely ill patients. Lynn Kemper, and she's gonna wave. Lynn Kemper is also a nurse on the acute care team and a special flow pool nurse. Lynn has 25 years of expertise, and she cares for the most critically ill patients. David Becker is a member of our flow pool team, and he has been reassigned for the entire pandemic to care for patients on our COVID units. And Kivalina Clark is on the front line in the emergency room, and she is a member of our emergency room team, and she's gonna share her experience with us as well. So thank you for my 4 guests for joining us. I know that our community wants to hear your stories from the front line, and I'm gonna give each of you a chance to share your experience. Amy, I'm gonna start with you.
Okay. Well, being in the float pool, special float pool nurse means that you can be reassigned based on the hospital needs to meet the patient care at that time. So when COVID started, our boss had contacted a handful of us special float nurses and said that we needed to start a COVID ACT team that was just responsible for the acute care. Let me back up, acute care team, which may also be familiar, like rapid response team for the COVID units. And so our focus was just on those patients on those units. So we quickly got in contact with each other because this was starting immediately and our current positions were ending and this one would be starting. So we were texting each other saying what was going to look like. But fortunately, my position prior to becoming a COVID acute care team nurse, I was a resource nurse for surgery service for 2 years prior. And during that time, I was fortunate that I would go to all the codes, all the rapid response events, and I learned and observed over those 2 years how these expert nurses that were already in the ACT team position, how they did their job, how they got an ICU bed if they needed, how to contact patient placement, how to contact the doctors. And so taking this knowledge, I was able to bring it to the other nurses that were called upon to do the COVID response team. And we just kind of threw things together. It wasn't always pretty, but we just kind of learned from each other and just picked up and went with it. Nursing is nursing. If the patient is not breathing well, you fix that. If it's head to toe. So kind of what our day looked like was we would come in and there was always policies and new procedures that we had to look up and see what was changing because nobody knew really what was going on. We were, just looking at the rest of the country and kind of doing what they were doing and going forth from there. So the hospital would put out daily updates, and so we would start our shift off looking at the updates. What's new? How do we transport the patients today? What kind of oxygen requirements are needed, for specific patients? And then we would also, as we would change shifts, we would tell the off-going nurse or the ongoing nurse, which patients were on our to-see list or keep them on the radar list. And, that's kind of how we would, keep the patients that might be more critical, on the forefront, and then we would watch them through the night or through the day, through the shift. So other things that we learned going forward through this COVID situation and time was learning how to be safe. Mask, gown, gloves, goggles, face shield, putting it on the right way, taking it off the right way. One thing I remember going into some of the rooms on a critical call would be, I'm gowned up in the room and my phone's in my pocket and it's going off, but I can't touch my phone. So quickly we learned, leave the phone outside the room on the outside table and someone else would answer it. Another practice that we kind of found in the moment that worked best was to have a bag of quick supplies, syringes, IVs, tubes that could easily be tossed into the room so we didn't have to go out and undress and dress back up and waste the protective gear. So we learned as we went along, and we would share our experiences every day with the off and ongoing nurses, so they would learn as well. Another thing that we had learned to try to get through was working with a stroke patient and using iPads for evaluations instead of having the doctor right at the bedside with us, and doing the evaluation with the neuro doctor, through the iPad was kind of an interesting experience and a learning experience. And sometimes we just had to use our phone because the iPad was being used elsewhere. So you just have to be flexible and learn from the day. So I think being on the COVID Act, the rapid response, the acute care team with COVID has taught us how to because everybody didn't know what was going on. Nurses were scared, doctors were scared, we were scared. We didn't know, what to expect. But keeping the team together and talking daily about our successes and unsuccessful things, helped us. So.
Thank you, Amy. I just want to say a minute about the acute care team. Amy makes it sound a little easy. At the beginning of the pandemic, we had really critically ill COVID patients that we weren't sure how to care for. And if anyone had questions about the care of these patients, they called one of our acute care team members. And so they were caring for the most critically ill patients, supporting their colleagues as they learned, all at the same time when they were learning themselves. So they are our most expert nurses, and you can hear the pivotal role that they played in helping us meet the needs of the community. Thank you, Amy. Lynn is also a member of our acute care team. Lynn, can you tell us a little bit more about your experience?
Thank you, Angeline. And yes, we did persevere. This was an incredible, incredible year. And for myself, I am so proud that I got to be part of the hospital's response to this pandemic. It really has been the biggest learning experience of my 25 years in nursing. I did get to serve on the ACT team with Amy, as well as Kelly and Lana, 2 other nurses from the special float pool. We were assigned this by our boss, Laura Jollenbeck, and she was really incredible because she allowed us freedom. She allowed us the freedom to change things, to learn things and apply them. We just had support and freedom, and I think that's one reason why it was so successful. So, as Amy was saying, our first job was that we were supposed to be there when patients' conditions were declining. That was our #1 job. But our response to that, Amy pretty much explained all of that, but we took on all kinds of other roles in the meantime that were different than the actual role that we were really assigned to. So one thing that we did is that we collaborated with physicians. We had key physicians that were within the hospital. We also had key people within the infectious disease department where we were gathering information. What was the CDC saying was the latest information on, how much oxygen the patient should be getting, or whatever the new thing was for the day. So we were staying right on top of everything really what the world was learning. So that was really great. The second thing that we did is we made ourselves educators and mentors for nurses. This time was a very frightening time for a lot of people. Just like Amy said, we had brand new nurses that just graduated that were assigned on COVID floors. I mean, it's scary enough just being a brand new nurse, let alone being thrown in the middle of a pandemic. So we mentored these people. We checked in with them. We made sure that they had our phone number on hand all the time, that we were there to answer any questions. We invited ourselves to the unit's huddles. A huddle is before a shift starts, the nurses kind of huddle together, and if there's anything that needs to be said from the manager to the nurses, that would be the appropriate time. Well, we invited ourselves to the huddles and shared the newest thing that was coming out. We helped them with education on what things to look for in these patients that gave you an inkling that they were headed in the wrong direction. So, these COVID patients were different than most respiratory patients that we had ever taken care of. They had different vital signs, different things changed in them that were different from most of the respiratory patients that we had. So this was new. So we were sharing all of this information with the nurses. We were helping them in keeping up with the monitors on the floors, that, the cardiac monitors where they could see the patient's oxygen saturation and the patient's heart rate, to keep tabs on that, because those vital signs would give you an inkling that something was, not going in the right direction. So that mentor part, I think the 4 of us nurses really loved that part, to teach and to help these nurses be more comfortable and say, hey, you know what, it's okay, because we're scared too. It's all right. This is how you do it. Let's practice this again. So that was a very exciting part of our job. Another thing that we did is we were available for really anything that the nurses needed us for. We were often called to start IVs on patients. And we found that all of our years of experience, think about this. If you have a task that you do every day and you know that task, you know how to do that task, you could do it with your eyes closed. Well, imagine doing that task with a plastic sheet over you, gloves on, a mask, and face covering that fogs up every time you exhale. And you can't even see the patient's arm to really start an IV. I mean, we were challenged, and we had been around for much longer than a lot of the nurses on the floors. So it was challenging for us too. Another thing we did is we were part of the education for the whole hospital in teaching the nurses how to correctly swab the patients for COVID. It seems like it would be an easy task to do, but there were CDC guidelines on how to do it correctly so that when that specimen went to the lab, you could actually trust the result that was coming back. So we set out to educate the hospital. So we trained hundreds and hundreds of nurses throughout the hospital. It was kind of a train the trainer kind of thing, where we taught someone how to do it. They showed us back, and then boom, they're the trainer for a group of nurses on their own floor. So that was a really exciting thing. Lastly, one thing that a few of us did is we kept track of the patients that were on comfort care, the patients that were on the COVID floors that were put on comfort care, so there were no codes or anything that were going to be called on them, and basically they were dying. And nobody should die alone. And these people deserve to die with some dignity. And we went into these rooms, we talked to the patients, we held their hand, we made sure their blankets were all the way up to their shoulders, we prayed with them. We just spent time with them. And what we got to see is we got to see all of the nurses in the hospital do the same thing, that they were caring for these patients who were dying just like they were caring for the patients who were acutely ill. So that's really exciting to see the hospital, the way they came forward and had so much compassion on these people. Amy talked about the iPads, and actually Angeline did also. We had iPads for families to be able to see and talk to the patients that were on comfort care, as well as the other patients who were just being cared for on the unit. So every patient, every day, was offered a time for them to FaceTime on our iPad, for them to be able to connect with their family. We were doing everything that we could within our power to help them connect with their family and help them get better so that they can get out of the hospital. We, as a team, I can say, put our heart and soul into what we did. And I, for myself, am very proud of what our team has done. I'm proud of what the whole hospital and what all the nurses did in stepping forward and taking care of patients in a time that was unprecedented in our lifetime. So thank you.
Thank you, Lynn, for those pearls of wisdom. And I just want your story and your insights were so rich. I just want to spend a little time with you, because in addition to the tremendous clinical wisdom and expertise, I also heard a theme of compassion. I also heard the theme of teamwork and collaboration. I heard the roles of nursing, nurse as innovator, nurse as knowledge worker, and the theme of compassion was just nurse as teacher, nurse as mentor. And so you really captured the depth and breadth of the important roles that we play on a daily basis, but especially during this pandemic. So thank you, Lynn, once again. And now we'd like to hear from David. As I said earlier, David has been reassigned for this last 18 months to care for our COVID patients. So David, we are looking forward to hearing your insights.
Yeah, I was reached out by our manager. They were looking for volunteers at the beginning of March for if this were going to progress, who would be willing to take a role on the floor, and I said I would, and she responded about a week later saying, okay, you're going to teach the special float pool how to properly use PPE, and a couple hours into it, she said, all right, it's time to go now, we're getting patients. And so I got just kind of thrown into it, and it was on 82 ICU, and the next day they opened up 52 as a med-surg floor for COVID patients, and it was just starting from scratch, and we really, we'd come across different issues every day, but we just innovate, we learn, we didn't complain, we just continued to drive forward to provide the best care to these patients however we could. It was unknown for us, it was unknown for families, it was unknown for everybody, and I did take, Barnes had their housing, and I lived in a hotel for the first 8 months, 9 months, just to protect my family, and it just seemed like the days would start at addressing the patients, and they just would never end because the phones would ring nonstop. You're constantly talking to family, trying to explain them in the best way, the knowledge we know, to share to their family members, and then when you get off work, your phones by family and support are just checking in on you, but also saying, hey, you know, my grandma's got it. What should I be looking for? How should I be treating this? And so it was just pretty much a 24-hour job, but we've come together. I know more about my coworkers than I ever thought I would know. We went through grievances, we went through happy, we went through birthdays, we went through it all. And at the beginning, you just kind of come together as a random group, but then we would continue to ask each other information, feed off each other. What did you learn about this? Turn to the ACT nurses. We all were learning together. It was never like someone talking down or talking up. We were all on the same playing field, working together to provide the best care for these patients. And I remember at the beginning when we first had patients passing away, we didn't have the iPads at the beginning, and like case managers and social workers would reach out to family, and they would fax us pictures, and we'd go get them and we'd post them up at their bedside and try and make everybody as comfortable as possible, and also treat them. And I remember the first day I took a patient out once they were COVID cleared and told them all the precautions to take and just continue to educate. And the main thing was just try and think long term. You know, we're all in it together. Let's all just take a deep breath and think long term and what's best. How are we going to get through this? And be able to vent to each other and be able to celebrate with each other in a safe way. And that's pretty much been my takeaway the whole time, is just think long term, be happy for what we do have, and what we don't have, we'll get eventually. That's about it.
David, thank you for the tremendous sacrifice you made so that we could serve the community. One of the important points that David made is the patient care unit where he works did not exist prior to the COVID pandemic. And so David and his team came together and opened an entire patient care unit under the stress that we were already facing to make sure that we were able to serve patients that need our care. And he talks about the tremendous teamwork that everybody came together to make sure that we were able to serve a community that needed us and still continues to need us. So with that, we'll go to Kivalina. Kivalina, can you please speak to the impact that COVID had on your life outside of the hospital and the role the community played in helping you to cope at work during the pandemic?
Thank you, Angeline. As frontline workers in the emergency department, we were in the trenches of this COVID-19 battle, facing the fear of the unknown. At the beginning, there was limited PPE, and we really didn't have a good understanding of the virus, and it was absolutely terrifying. Luckily, I'm very privileged to work with an amazing team of nurses, doctors, techs, and ancillary staff down in the ER that was there to support one another. I think some of the biggest fears were not just there at work, but what if we bring this home to our family? So it was not just a work thing, it was a how do we take care of the patients as well as take care of our family at the same time. I cannot brag enough about the team that we have down that I work with in the emergency department. Not only were we seeing patients with COVID-19, but we still saw patients who were level 1 traumas, who were coming in cardiac arrest or respiratory arrest, people having heart attacks and strokes. And I never once saw our team hesitate in any way to run to that bedside and provide that life-saving care to these critical patients, not knowing whether they had COVID-19 or not. It's amazing, the team that we have. I was also blown away by the support that our community provided us during these times. We had banners that were calling us heroes. We had supplies and food donated to us while we were working. And the amount of appreciation I have for the community and for the support that they provided us, caring for us while we were caring for everyone else. I know the virus has had a lot of negative impacts, but I feel like it's also really had an opportunity to bring us as a community, us as a hospital, us as nurses, techs, doctors, leaderships together in ways that I don't think ever would have. So it's been, although scary at the same time, it's been amazing watching everyone persevere and come together and make it through this pandemic.
Kivalina, thank you for sharing your insights and the powerful reminder of the role of our emergency department every day and during this pandemic. Because we care for the most acutely ill patients in our community, those patients often present to us through the emergency department. And throughout this pandemic, our team members have cared for trauma patients, other patients who were really critically ill without knowing if they had COVID-19. And so they really, especially at the beginning of the pandemic, really made a sacrifice to serve the community. And we are grateful for all that they do every day and what they do for patients, especially at the beginning of the pandemic. And for our colleagues, I just want to thank you for sharing your emotional experiences and insights. We appreciate the rich information that you shared with us tonight. And to our other community colleagues, you can hear from our colleagues that this was a team effort, a team of 3,000 nurses strong. And we want to thank you all for all you do every single day to make sure that we're able to serve the community. You make me proud every day to be a Barnes Jewish Hospital nurse. And before we take questions, I want to thank you on behalf of the panelists and all the BJH nurses for the support you've shown during the pandemic and beyond. You as our community, you've had an outpouring of love and support. We want to thank you for every message, every donation, like the ones that allowed us to purchase iPads, every gift of personal protective equipment, and for the food. We say our heartfelt thanks for all that the community have done. Your items and your love and support have truly lifted the spirits of our nursing teams when we needed it most. But colleagues, our journey is not over. COVID-19 and its variants continue to impact our community, our hospital system, and our nurses. And your continued support is always needed, and it is welcome. The most impactful support you can give our nurses now is to get vaccinated and encourage your family and your friends to get vaccinated. And as we look to the future, we will prepare our nursing students, our heroes in training at Goldfarb School of Nursing at Barnes Jewish College, to embrace what it means to be a nurse, to protect, promote, and optimize health, to prevent illness, alleviate suffering, and to persevere in the face of uncertainty and to always be prepared to serve whenever the community needs us. And with that, we'd be honored to accept your questions.
Thank you, Angeline, and thank you to all the panelists. Our first question is for you, Amy. Amy, you referenced changing procedures. Prior to COVID, how often did procedures change?
Procedures meaning like assignments, or I'm not quite sure.
Yes.
So how Special Float is assigned, we had 6-week assignments on a certain unit, either medical unit, ICU unit, or wherever. So after COVID started, we were short nurses. We were had a higher need on the COVID units, and so that's how our assignments were changed based on the need of patient care within the hospital. So. And for me personally, I was in the resource position for 2 years as a Special Float nurse, and then transitioned to the COVID acute care team.
Thank you, Amy. Our next question is regarding the iPads, which a few people have mentioned tonight. The iPads are in part thanks to the support from the foundation and our community. What kind of support can the community provide now?
Wow.
I personally think community's been doing a fantastic job being there for us, as I said, being there to care for us while we're caring for everyone else, getting vaccinated, showing support. I mean, that's pretty much what we need. I feel like it's just having that support, knowing that you're there for us while we're taking care of everyone else.
And I would just add, as we look beyond the pandemic, we've described tonight the really powerful impact that nurses have on the lives of the patients and families they serve, as well as the impact on the health of the community. You can help us by supporting us and making sure that we always have nurses available, by supporting our heroes in training to make sure that should we face another pandemic or whatever natural disaster or catastrophe we face, or day to day for patients who need health care, that we always have a nurse that's fully prepared to serve.
Thank you very much. Our next question. David, you mentioned staying in a hotel to protect your family. How did you care for yourself while having to be separated from your personal support network?
I basically just took it one day at a time. When it first started, I had no idea how long it would last or when it would end. I mean, I still have those thoughts today, but just took it one day at a time, try to be healthy, go for walks, be able to vent to the community and family and friends. So I also ask that you don't get tired of us venting about it or discussing what we learned, because I know it kind of topics not everybody wants, but it's all we do, and we're still here and we still care and we're still learning. So it's kind of a popular conversation, but I just took it one day at a time and communicated with my family. I'd go over there. I had like my COVID backpack with my wipes and supplies, and I could sit outside at the beginning with just to keep everybody safe. I'd have my own plate and utensils, and obviously we've moved a long ways from that, but I won't ever forget it, and I won't ever forget all the outreach from everybody else. When I got my vaccine, I made it a point to thank you guys who supported me through this whole time.
Thank you, David. Our next question. First, our viewer would like to say thank you to each and every one of you for the enlightenment this evening. How would you describe the current mental health of the pool of nurses who have navigated the pandemic? How is everyone holding up?
Well, I think, first of all, everybody is tired, worn out, especially on the COVID unit. I mean, the whole hospital in general, yes. But when we were covering, I guess in the height of the pandemic, we had 6 non-ICU COVID patient floors. And then there was like 3 or 4 ICU, COVID ICUs. And so, it took a lot out of the nurses, and they were just short-staffed and just worn out, run no energy. So, but I think, the perseverance and the community support and the family support, the nursing support, everybody's come together to, just, you go home, you sleep it off, and you're back ready for another 12 hours. So.
Thank you very much. And this is a reminder for everyone joining us tonight. If you have a question or a comment that you'd like to share with our panelists, to please leave it to the right of your screen. And our next question, Lynn, if you wouldn't mind speaking to this, what advice do you have for our heroes in training at Goldfarb School of Nursing?
My advice would be that they would find that thing inside them, that thing that's deep inside them, that inner drive of why they became a nurse in the first place, and find a way to never lose that. And I think that's what's kept me going through this pandemic, and actually through my whole nursing career, that there was always a true purpose and a meaning behind the fact that I chose to become a nurse. And even when things got really hard and there were times where I wanted to quit, I remembered that this was a calling on my heart. This was a calling for a commission for me to do, a mission in my life that was one of the purposes that I believe God created me to do. And when I kept that as my driving force, I didn't get tired. And I didn't get so worn out that I had nothing left. That would be my advice.
Thank you, Lynn. Our next question, Angeline, if you don't mind speaking to this. How were the waves of COVID different, and how has that helped prepare for the current and future waves?
Each wave has its similarities and its differences. In the first surge of COVID, we didn't know how to protect ourselves, so we were learning in the moment new policies and procedures that my colleagues described to you, that quick learning and integrating new knowledge. The second wave of COVID, it was the acuity of the patients, and actually we had many more patients than we had during the second surge. In the third surge, it's complicated. While we know a lot more how to treat COVID and how to protect ourselves, our teams are tired. And they have some concern about community members that have not made the decision to get the vaccine, because we're wondering how our community could call us heroes and then at the same time not believe in science and not make the important intervention, take the important step of getting an intervention that will help us to put the pandemic behind us. So each of the surges had its unique similarities and differences.
Thank you, Angeline. And our final question of the evening, what advice can you offer to organizational leaders who want to keep their staff safe, but also want to serve the community and gather in person?
I would say it's not time yet to gather in person. We sometimes, as community members, want to go back to life as we know it. We want to go back to that feeling of being normal. And when we do that too quickly, we end up having, with the spread of COVID, and having more COVID cases. So I think we have to wait until the time is right. We have to make sure that we have enough members of the community who make the important decision to get the vaccine. And once we've reached immunity, or a certain number of patients who have the vaccine, or the community members who have the vaccine, that's the time that we can resume gathering, which we all want to do, but we don't want to do it prematurely. We want to do it when the time is right.
Thank you for joining us tonight for the Leading Edge Nursing, Persevering Through the Pandemic and Beyond. I'm Dick Miles, the chairman of the board at the Foundation for Barnes-Jewish Hospital. And thank you, Dr. Peters-Lewis, for your eye-opening presentation. It is comforting to know our nurses are in the hands of such a skilled leader. And a special thank you to our panel of nurses. Your dedication and commitment is inspiring to all of us. Nurses are an essential part of the health and well-being in our community. The National Academies of Medicine has released a study emphasizing the importance of our nurses, not only in treating the sick during times like COVID-19 pandemic, but being critical to the prevention of future outbreaks. As our population ages and health risks continue to challenge us, the need for talented nurses continues. We are so grateful for all the ways you support our nurses through your partnership with the Foundation. Whether you help our heroes in training at Goldfarb School of Nursing at Barnes Jewish College through the scholarships and the Emergency Compassion Fund, or provide ongoing training and education to our nurses at Barnes Jewish Hospital, every dollar makes a difference, and we thank you. Please consider sharing something you learned tonight with your friends and family. Tell them about our event and share the video, which will be emailed to you shortly. The recording will also be posted to the Foundation's website and Facebook page. If you haven't already, please take a quick survey in the Q&A area on your screen. Your feedback helps us to shape future events. And be sure to visit our website at foundationbarnesjewish.org to see our future lineup of events. We are hopeful to see you again in person soon. On behalf of all of us at the Foundation, thank you for being such an important part of our mission to enrich lives, save lives, and transform healthcare. We wish you well and have a good night.